Thank you. Thank you. My name's Gary Brown and I'm here to represent Cabonne Council. This is also a workforce question. But first off, I'd just like to say that last year, two very close relatives of mine were cared for at Orange Base Hospital, and they both suffered serious medical emergencies, and I couldn't be more pleased with the care they got. It was totally astounding, and they had very positive outcomes, and I'd just like to congratulate our health services on what they were able to do for them. There's also...
Thank you.
My pleasure. There's also other patients who sometimes get treatment for either medical emergencies or serious operations, and they get sent to smaller regional hospitals or district hospitals to, I guess, recover for a period of weeks before ultimately being discharged. They also receive very good nursing care in those situations, but the problem is they don't always get the rehabilitation services they need. The physiotherapy isn't there as much as it should be, and I'm aware of some instances where patients have suffered very negative outcomes because they haven't been able to access the rehabilitation services they need in those smaller hospitals. Is there anything we can do about this?
Well, I guess in many ways it's been addressed, but I'm sure, the workforce issues again, I'm happy for Robin to reiterate, but it's...
I think the points you raised is very, very important, and it also moves on to the role for our smaller facilities. I mean, I work in Molong. We take a lot of patients back from Orange, which takes the pressure off the acute services in Orange, and I think this is a fundamental, important use for our smaller facilities, because it provides a service in a small town. It provides an interesting work for the nurses, which makes them more likely to want to work there. And it's a focal point for our communities, so it's very much important that that role is expanded. I agree with you completely. We need to have more rehab facilities, and that again comes down to workforce. But with this greater autonomy that we have, I'm hopeful that we will be able to make a real big dent into that problem, because if we can make it an attractive package for doctors and allied health and nurses to work in a smaller facilities, then I think that will alleviate a lot of the problems that we're suffering. So that again, it comes down to workforce.
Thank you.